basically you might look like you have a mental disorder. You may look like you have anxiety disorder, but it may be that you're just using a medication or using a substance, and you're in withdrawal, and now you have anxiety, so that's really a substance-related disorder. You may look like you're having psychosis, but if you're doing methamphetamine, that may be a substance-induced psychosis. So the substance-induced mental disorders is an important part to consider along with substance use disorders, because too often people describe signs and symptoms as a mental disorder. You have bipolar disorder because you have mood swings. You have anxiety disorder because you have anxiety when it's actually withdrawal. You have major depression when it's actually cocaine crash. So substance-induced disorders look at is the disorder representing a clinically significant symptomatic presentation of a relevant mental disorder. Yes, this is looking like anxiety disorder. This is looking like major depression. This is looking like bipolar disorder. But then they're saying, well, did the disorder develop during or within 1 month of substance intoxication, withdrawal, or taking a medication? Well, if it's closely related time-wise to a substance or a medication, this might be a substance-induced disorder, not what looks like a mental disorder. And is the substance that they're taking capable of producing this? Is this alcohol that is a downer that could produce depression? Is this LSD or methamphetamine that could produce a psychotic episode? Is somebody doing uppers and downers that could produce mood swings? So the substance that they are using has to have a chance of producing what the clinical presentation is. And then you distinguish a substance-induced disorder by saying, well, let's make sure it's not actually an independent mental disorder. Is this a substance-induced disorder, or is it actually a mental disorder? Well, some of the ways you can tell that DSM-5 talks about is, did the mental disorder precede the onset of severe intoxication or withdrawal? In other words, did you have this mental disorder before you were even involved with signs and symptoms related to substance use or withdrawal? And has the mental disorder persisted even though you weren't using any drugs? If you've got a disorder that preceded the substance issues, and if it's still there even when you're not using, then maybe this is a separate independent mental disorder and not a substance-induced disorder. All right, well, I know that's complicated.